Hi, everyone. Thank you for attending this talk in the Books for a Better World series with Georgetown College and Georgetown University Library. I'm Stephanie Rojas, the publicist at Georgetown University Press. We're excited to welcome School of Foreign Service professor David Hollenbach today. He'll be talking with Georgetown University Press director Al Bertrand, and the Q&A will be moderated by Shannon O'Reilly, our digital publishing and rights manager. Feel free to send in your questions during the talk and we'll address them throughout. You can also use the Q&A function if you experience any technical difficulties. We ask that you please refrain from using the chat function. After the event, there will be a brief survey and a recording will be made available by the end of the day tomorrow. Thank you again for joining us today.
Thank you, Stephanie, and welcome everyone. I'm joined today by David Hollenbach, the Pedro Arrupe Research Professor in the Walsh School of Foreign Service and Senior Fellow in the Berkeley Center at Georgetown University. David is both a distinguished scholar of human rights and migrants and an advocate who has worked with the Jesuit Refugee Service in many parts of the world. So thank you for joining us today, David.
Thank you very much, Al. It's a privilege to be with you, and I look forward to our conversation.
Thank you. So the focus of our talk today is going to be on migrants and refugees in an age of crisis. But I wanted to start a little further back, David, and talk to you a bit about the ethical framework that you laid out in a book, which I hope everyone can see, which you published with Georgetown University Press last year. The title of the book was Humanity in Crisis. It's a really striking title. Can you tell us a little bit about what you mean by that phrase?
Well, the title Humanity in Crisis has a twofold meaning, really. First of all, the book is about our response to refugees and other forcibly displaced people around the world. And the latest statistics from the United Nations High Commissioner for Refugees indicates that there are over 70 million forcibly displaced people in the world. These are people who've been driven from their homes, involuntarily fleeing war, primarily fleeing war, and some others fleeing natural disasters. But that's one of the dimensions of the humanity in crisis that we're talking about. 70 million human beings facing the crisis of being displaced from their homes by conflict and war. The other dimension that I'm very strongly committed to and highlighting in the book is that humanity also refers to the common humanity that we all share around the world. And what's happening with refugees is that they've been driven out of their own homes. They have, in many cases, they're asylum seekers with no place to go. They fall through the cracks of the international system, so to speak, between states, between one state and another. And the fragmentation of the world and the building of walls to try to exclude these people from finding a new home, the lack of receptivity to them is another way in which our common humanity, the humanity that binds us together as fellow brothers and sisters, is in crisis. And that's the second meaning in which I try to highlight the crisis that we're facing about the inadequate response to the needs of the 70 million displaced people of our world.
Thank you. And I'll just remind participants to please ask questions using the Q&A function, and I'll either weave them into my own questions if they relate, or we'll get to those as we progress through the talk. So David, could you, before we get into the current COVID-19 situation, could you tell us a little bit about what the role of faith communities are in healing a humanity in crisis?
Well, that's a very important subject for me because I'm a theologian. I've also done a lot of work on ethical and religious issues of human rights and so forth. But the religious response to the displacement of people and refugees around the world is an extraordinarily important one. Here in the United States, for example, there are nine agencies that serve the task of resettling refugees who are coming to this country. 6 of the 9 are faith-based. They're church and synagogue and mosque-related agencies here in this country. If you go to any number of other parts of the world where refugees are still in camps and fleeing violence. If you go to a place like the Kakuma refugee camp in northwest Kenya, where there are many Sudanese refugees and many Somali refugees and so forth, many of the agencies that are working there to try to provide assistance to them are also faith-based agencies. And this is not an accident that faith communities are so directly involved. If you look at the three great monotheistic religions of the West, Judaism, Christianity, and Islam, all three of them have a story of forced migration at their founding moments. The story of Israel, the story of the Jewish people, begins with the Exodus, initially the flight of Jews from their homeland into Egypt, and then their exodus from Egypt back to the Promised Land. Christianity, shortly after his birth, Jesus with his mother Mary and Joseph had to flee from Bethlehem to Egypt because they were being persecuted by Herod, the ruling Roman ruler on behalf of Rome. And what they had to do was flee across an international border from persecution, which is the technical definition of a refugee in contemporary international law. That's a bit anachronistic to invoke contemporary international law. But according to the criteria of contemporary international law, Jesus, Mary, and Joseph were refugees within less than a year of Jesus's birth. And if you go to Islam, the founding moment of the Islamic community, as understood by Muslims, is the flight of Muhammad from Mecca to Medina. It's called the Hijra, the migration. So the beginnings of Islam are tied up and with migration and force. So there's no accident that the religious believers of those three communities all have direct engagement with response to the needs of displaced people as very close to the center of their religious beliefs. There are many other ways I could get into that, and my book deals with that to some degree, as well as dealing with the secular reasons for response. If you go to the Universal Declaration of Human Rights, it says these rights apply to all people, independent of what country they're from, and independent of whether they're refugees or not. So there are both profound religious and profound secular reasons for response to the needs of displaced people.
Thank you. And so if we turn to the current pandemic, can you please tell us a little bit about how the current crisis has affected migrants and refugees in particular, and whether we're seeing different outcomes and responses in different parts of the world?
Well, the situation is very grave for displaced people being in the presence of this COVID crisis, the coronavirus crisis, or the COVID-19 crisis, whichever way you want to call it. But these 70 million displaced people that I've described, who are forced migrants, many of them are refugees who fled across a border. Others are internally displaced within their own country, and they're not technically refugees, but they're forced migrants. They're people who have been driven from their home. Many of them live in camps where they're being cared for under the auspices of the United Nations High Commissioner for Refugees and many of the religious agencies. But in those camps, they're squeezed together into very small spaces. They have almost no space and no capacity for social distancing, as we've come to call it. They have very little health care available to them. There's no testing. There are very few physicians available in those situations. And those are the ones in camps. Others, if you go into a place that I'm familiar with in Nairobi, Kenya, many of the refugees who are not in camps in Kenya are in the central urban slums of Kenya. There's a section of Nairobi called Kibera, where it's about a mile by a mile, about a square mile in size. And the estimates are almost impossible to settle on how many people live there. But the best guess is that there are about 1 million people living in a square mile in Kenya, in this Kibera district of Nairobi. Needless to say, they're extremely poor. They have no clean water. They can't wash their hands in a way that protects them from COVID-19. They have very little medical care. They have no medical care on most cases. They have no social distance to separate. So these people are very, very vulnerable to the virus. And if it has not yet expanded there, it's begun mainly in China and Europe and in North America. But when it hits the developing countries like that, it could be a genuine disaster. One of the leader of one of the major refugee study groups has held up the possibility of what he calls a COVID-19 catastrophe. The people in these refugee settings there are extremely vulnerable, and they're also provided with very little support, like the kind of support we have in this country.
Thank you. I have a related question in the Q&A from Michael McDowell, who asks, which areas of the refugee resettlement process are most impacted by COVID-19 pandemic? Are the negative impacts on housing, immigration, employment, insurance, etc., equally distributed?
Well, I mean, for starters, the United States is refusing to admit anybody. So we're not, if we're talking about here in the United States, where refugee resettlement is over, it's done. There isn't any. And asylum seekers at the Mexican border are seeking flight. They're fleeing from persecution in places like Guatemala and El Salvador, where the gangs are. They're trying to get into the United States, but the U.S. won't admit them. So that's a way in which the refugee crisis is being directly affected, because the administration, our present government in the United States, is invoking the COVID-19 danger as a reason for excluding refugees and asylum seekers. So that's a very severe consequence about how we're not responding to the needs. Now, other parts of the world are trying to close borders also. So it's becoming, it's almost as if people are now in a situation where even though they're being driven from home by war, they have no place to go.
Yeah.
And that's a very severe danger in terms of the current situation.
Yeah, thank you. Yeah, I mean, one of the challenges, I guess, is that, there's some polling that shows the temporary immigration ban is actually quite popular with the public in the US. And that relates to a question that we have from Margaret Steinfels, which says, are the ideals of human rights law and national legal systems inevitably at war with one another?
Well, I mean, international law and human rights law basically state that we have duties toward these refugees. And so both international law and human rights law are very much on the same page on this sort of thing. And so there's a lot of grounds for saying that, especially asylum seekers, people seeking asylum, we have a duty to respect their needs for flight from very severe persecution. I'm not quite sure I fully understand the implications of the question, but certainly both human rights law, which talks about the right to seek asylum, it doesn't say we have a duty to provide asylum, which is where some of the legal issues get very tricky about this, but people certainly have a right to seek asylum, and therefore there's a very, very real challenge to our policies in this country and in Europe also. I mean, this reminds me of the situation that came up back in 2015 and 16, when there was the huge flight of Syrian refugees that ended up in Germany. Angela Merkel took the step of admitting almost 1 million Syrian refugees into Germany. And once they got there, there was a lot of political backlash, and Merkel then wanted the European Union to share the burden of the refugees that had fled to Germany. And the man who was then the Prime Minister of the United Kingdom, David Cameron, said, well, the United Kingdom will do its duty. We will admit 20,000 Syrian refugees into the United Kingdom over the next 5 years. Well, the man who was the Interior Minister in Lebanon said at that point, we are very grateful to Prime Minister Cameron for his willingness to admit 20,000 refugees over the next 5 years. But I would like to remind Prime Minister Cameron that Lebanon admitted that many Syrian refugees over the last 2 weekends.
Yeah.
Lebanon holds today 1 out of 4 people inside the borders of this country of Lebanon is a refugee, mainly Syrian, but also some Palestinian refugees. So most of the refugees in the world are in lower income countries. About 85% are in developing countries and 33% are in the poorest countries of the world. So even though the United States has admitted refugees in a very generous way in various ways of resettlement, and Germany certainly did in the days when Merkel admitted the million Syrians, we've come nowhere near close to being in a situation proportionally like Lebanon or like Turkey or like Jordan, or take Uganda. Uganda is one of the poorest countries in the world. Uganda has 1 million South Sudanese refugees inside its borders today. And we're nowhere near that kind of burden sharing in this country. And that's one of the challenges that we face right now, is how the developed countries, the rich countries of the world, can come to the aid of the poor countries that are hosting most of the world's refugees today.
Yeah, thank you. Perhaps I can ask a question from the Q&A that relates to your last comment there. We had a comment and a question from your colleague, William O'Neill, who I know works in the Jesuit Refugee Service in Kenya.
Yes, I know him well.
Yeah, he just had a comment that regarding your remarks earlier about what could happen if COVID-19 sweeps into these camps, that there are only 70 ICU beds, I guess, in the refugee camp that he's working in. But his question is that, can you comment on the rise of ethno-nationalism and the widespread failure to honor rights under the Convention, for example, of asylum? Can NGOs address such systemic distortions?
It's a very important issue and a very important question. And the resistance to granting asylum to people fleeing into, say, the United States, it's a very complex set of issues involved there. There's clearly a certain amount of xenophobia and religious discrimination. There's certainly been a fair amount of discrimination or desire to exclude Muslims. The United States has taken steps under the current administration to prevent migration into the country from a number of Muslim majority countries. And President Trump initially wanted to exclude all Muslims from coming to the United States. And so there is a kind of religious and ethnic prejudice involved here that needs to be dealt with. But secondly, and another dimension that I think is really important and needs to be addressed, is that some of the people who are most concerned about refugees and other migrants coming to the United States are less educated, poorer white people who feel that their well-being is threatened by migrants coming who are going to take their jobs. And there's some data out there that indicates that less educated white people in the United States, their life expectancy in this country is actually declining. They're facing what Angus Deaton, a Nobel Prize-winning economist from Princeton, has called deaths of despair. These are people who feel as if they have no future. They've given up. And one of the things that leads to so many deaths among them and declining, their death rate declining or their life expectancy declining, is that they're up against a serious economic crisis they're facing. And it's that is being manipulated by certain kinds of populist nationalist movements to become an anti-immigrant movement. In fact, the immigrants don't really threaten their jobs over that much. And so there's a lot complicated story about the economic impact of refugees. Most refugees actually pay more in taxes than American regular Americans do, and their educational level tends to be higher. They have a better employment rate and so forth. So they actually contribute more to the economy than they take from it.
Yes.
And so their impact on the economy is not what some people fear, namely that it's going to undermine the economy and take away jobs. It may displace some people in some limited areas, but overall, it's not a big threat to the economy. And therefore, I think what we've seen is a manipulation of the vulnerability of poorer, less educated Americans to lead them to think that they're going to get better if we exclude migrants and refugees. In fact, that's the wrong way to go. It's basically demagogic manipulation by certain politicians that have led people in that direction. And that what we need is a form of leadership that goes in the other direction, that helps people to see that welcoming these people here will not threaten them in the way that the current leadership is trying to manipulate them to think they will be. So that's a direction in which I think we should be going, and we need to pay more attention to the needs of the less educated poor in this country, and help them see that, help them get into a situation where they don't have to be so fearful.
Yes. No, thank you. There's a related question from Christopher Jeffords, which is about what happens to migrants in the U.S. who lose their documented migratory status after they lose their jobs due to the virus. So what happens to a group of people who maybe can't get home, but also are not eligible for benefits and other things?
Well, I mean, I certainly think that we have some obligations toward those who are here in this country. If we have people here, one of the things that the Catholic Bishops' Conference Office of Migration and Refugee Service has called for is to say that all people should be eligible for testing and treatment for the COVID virus independent of their immigration status. Now, a pandemic, of course, which is what we're facing, is not something that you can deal with just by protecting some of the people. If we don't deal with this for everybody, it's going to recur for other people around. So if we say, well, we'll just keep those poor people and we won't help them, and we rich people are going to be safe from the disease, that's an illusion. You can't be safe from the disease if you're living in a society where a pandemic is operating. And that applies both within countries like the United States, but it also applies globally. It's another reason by saying if we're going to respond to the COVID-19 crisis in places like the developing world, it's partly a kind of a result of our moral obligation to help those who are poor, but it's also in our self-interest.
Yes.
Because if there's a lot of the United States intervened in Western Africa to deal with a danger of a very severe health crisis there back a few years ago, because we were afraid the disease was going to come to the United States. We have to find ways of dealing with things like SARS or HIV/AIDS or now COVID-19 in a way that recognizes that we can't insulate ourselves from this without taking care of the well-being of people in many parts of the world and in many parts of our own country. This is what it is to say that healthcare in the face of this kind of disease is a public good. Right. You can't just deal with it privately. You have to deal with it among all who are affected by it. And that means global common good, not just national common good.
Yes, thank you. So I have a question from Peter Henriette, who says he serves as a chaplain in an ICE detention center in Tacoma, Washington. And he's really asking about how do Catholics frame pro-life so that it encompasses issues like the ones that we're talking about, that he's saying that bishops seem most interested to and speak most strongly on abortion. So how do we change views of what pro-life means?
Well, I mean, certainly the case is Certainly, this is a very profoundly pro-life issue. We've had, 60,000 deaths in the United States over the last month as a result of this disease, which is more people now than the number of Americans killed in the Vietnam War.
Yes.
This is a very severe challenge to the lives of Americans, and we have to respond to that in a way that takes it fully seriously as an agenda for the promotion of the protection of the dignity and life of all of our citizens, both in this country and globally. Now, I would say that some of the American bishops have stressed the abortion issue, but I also think, it's very much the case that Catholic Relief Service, Catholic Charities, the Bishop's Migration and Refugee Service are deeply engaged in efforts to respond to this crisis of COVID-19 and the coronavirus in a way that is very strongly committed to the promotion of the protection of human life in this area. So although there may have been some sort of PR moves on a few bishops dealing with this in a way that seems to imply that abortion is primary, the Pope has been very explicit in saying, Pope Francis, that we cannot regard abortion as somehow more important than migration questions as a pro-life issue. Pope Francis is he said that very explicitly several months ago, maybe a year ago. And so I think that that's another side of the story that needs to be taken into account. So it's a human rights issue, just very vigorously, I would say that.
Thank you. So I think we have time for one more question. So we have one from Sara Rienda de la Mata, who says she worked with Syrian refugees in Lebanon and saw firsthand their poor living conditions. And so she's asking, she's saying that they often have trouble being able to get money out of banks. And so what are the ways that we could help those refugees more directly, if any?
Well, what the Global Compact on Refugees, which was approved at the United Nations General Assembly in December 2018. Unfortunately, there were only two countries that voted no on it. One of them was the United States. But the rest of the countries of the world approved a new Global Compact on Refugees. And part of that compact is a commitment by the nations of the world to find ways to bring the resources of richer developed countries to come to the aid of countries that are doing most of the refugee hosting in the world, which is a middle income country like Lebanon, as the questioners referred to, but it's also a lower income country like Uganda or a low income country like Bangladesh. Those countries are hosting most of the refugees in the world. And the response that we have in the West and in Europe and in North America, and I would say in the Gulf states where they've got plenty of money from oil, is to provide assistance to the countries that are providing most of the protection and most of the support for the refugees that are fleeing from violence in other parts of the world. This is a challenge, therefore, that we're working, and the global community is trying to find implementing ways to follow this up. And I think, therefore, finding ways to advance the agenda that is flowing out of the Global Compact on Refugees to take steps in this direction is the way we need to go. It's sometimes called burden sharing. I think the Global Compact prefers to call it responsibility sharing. We have to share the responsibilities across borders here. And I think that there are very real ways that we can do that. We have the resources to come to the aid of those poor countries if we recognize that those fellow human beings are in the same boat with us as human beings.
Yes.
And we also can, in the face of the COVID-19 crisis, recognize that we have a responsibility to protect them because we want to protect our own health as well. Yeah. So these are some directions in which I'd urge us to go there.
Yeah. Thank you. So we've come to the end of our time today. Judging by the number of questions we haven't gotten to and just the richness of this topic, we could go on, but I think we're going to have to leave it there for now. But I hope we'll have a chance to have you back and continue this conversation, because it's obviously a very important one.
Thank you very much, Al, and I thank all the questioners too. It's great to have people as part of the discussion.
Yeah, it's very, very engaged. I wanted to say as we close that next week we'll be talking to Janine Turner, who's a professor in the Communication, Culture, and Technology program at Georgetown. And we'll be talking about communicating in a time of crisis. So please join us if you can. And I hope everyone stays safe and sound and healthy, and that we'll see you at noon on Thursday next week. So thank you again, David, and thanks everyone.
Thank you.